Hi, my name is Tracy G. I am doing a video presentation for my intro into healthcare on the Indian Health Services, IHS, which is an agency that is within the Department of Health and Human Services that focus on providing federal health services to American Indian and Alaska Natives. The federally recognized tribes grew out of a special government-to-government relationship in 1787 because a lot of these tribes have their own government, as one would say. They have their own laws, they have their own government, so they are kind of maybe a state within a state, but because some people may feel that the American Indian or Alaska Natives are not truly American citizens. The federal government wanted to establish a relationship with them and see that they are seen as American citizens and receive the same type of public health services and maybe benefits and programs provided by either federal or state programs as well. So the IHS, its main mission is to raise the physical, mental, social, and spiritual health of American Indian and Alaska Natives. So to make sure that they have all their needs met, just like all the American citizens are provided as well. Now, their goal is to ensure that comprehensive, culturally acceptable, personal, and public health services are available and accessible to American Indian and Alaska Native people, which was probably different in 1787 or even in 1921 or before our government really put in place that healthcare providers in particular, had to work around cultural differences for each patient. So if a patient comes in and doesn't want to receive an immunization because it's against their religion, they have the right to do that. And it's basically kind of the same thing with the American Indian and Alaska Natives. They have the right to see a provider who accepts their cultural or religious preferences as well. So like I said, it may have been a little bit different back then than it is now, because a lot of our healthcare providers kind of already know that and proceed on with that today. But basically that is what the American government provides for our American Indian and Alaska Natives, and the Indian Health Services Agency is kind of like an overseer of that they continue to receive those services as well.